Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. We have a very special guest with us today, Dr. Ryan Scholz, who is the state veterinarian. Who knew we had one? And he's the state veterinarian. He's going to be joining us today to talk about the many diseases that pass between humans and animals, and especially about this highly pathogenic avian influenza, which we've heard quite a lot about in the last week. Again, what we start always with is answering questions. And so we'll do that today. If you have a question, send it to us at Facebook questions at douglaspublichealthnetwork.org. That's Facebook questions at douglaspublichealthnetwork.org, and we'll get to them. This week, we had a question about the vaccine for children less than 5 years of age. So as you know, we have vaccines for people 5 and above. They seem to be very effective and really quite safe. But we've not had a vaccine for kids under the age of 5. There have been a number of vaccines that have been proposed by both Pfizer and Moderna, and they've had kind of a rocky start. We thought they were going to maybe get approved last fall and then this spring, and now they may come again. I still have not seen the data on these vaccines, although they're said to be quite effective. Still not seen the data, so I really can't comment about what's going to happen. They're apparently going to be discussed by the FDA on the 14th and the 15th of June, and we should know a little bit more at that time. What we do know is that kids less than 5 are much less likely to get seriously ill than people who are older, especially people who are over the age of 70 or 80. But kids in that age do get it. They do get sick. They do pass it on to parents and grandparents. And we've seen quite a few younger kids who have long COVID. They have COVID. They get over the acute disease, but are quite sick for a while thereafter, either very sleepy, so sleeping 20 hours a day, really achy, really cranky, and some of them have just been not right for 3 or 4 months thereafter. So this long COVID that we get in kids is a concern, and we think we could reduce the incidence of that by having people who were vaccinated. So going through the COVID situation, we always go through the world and see how that's going. The world, things are pretty quiet at this point. There's still a fair amount of disease in Australia, New Zealand, although it's not causing a lot of hospitalizations and deaths. We still don't know exactly what's happening in North Korea and China. I think the data from those two areas is always a bit suspect, and the official report's far cheerier than probably what really exists. But in Europe and in much of the rest of the world, the disease is stable or decreasing. In the US, we're still seeing an increasing amount of disease, mostly due to the BA2 variant. But what we're seeing now, it's the BA2.12 and the BA2.12.1, which seem to be the predominant strains. Those strains are really contagious. So compared to the BA1, even more contagious than BA1, which was more contagious than Delta, which was more contagious than Alpha, which was more contagious than the original strain. So as these strains go out, the more contagious strains seem to gain footholds and then spread in the population. The good news is with the BA2 variant in the US, we've not seen a huge increase in hospitalization, a little bit of a blip, but not a lot of increase in hospitalizations. And while we continue to have 300 deaths a day, far more deaths than we should ever have, those number of deaths is fairly stable in the US. People always ask me to predict about what's going to happen about the future, and I always tell them that it's really hard to predict things, especially in the future. But if we look at the UK and look at Europe, I would expect we're going to continue to have a moderate amount of disease in the US for the next few weeks, and then it should be decreasing in June or July. In Oregon, we're still seeing an increased number of cases, but I think we probably are close to hitting the peak in Oregon. Most of the cases of COVID we're seeing are in the Willamette Valley and in the Deschutes area. We're also seeing an increased number of cases in Josephine, Jackson, and Douglas County. So in Douglas County, we're seeing between 20 and 30 cases a day, which is clearly up from where we were just a few weeks ago. We were down to less than 5 a day. But the number of hospitalizations has not really spiked. This morning, we only had 5 people in the hospital, so a relatively low number. We're still seeing deaths, and the deaths we're seeing are almost always in people who are not up to date on the vaccines. So when we look at our deaths for the calendar year 2022, the vaccine has been incredibly protective. We've only had 2 deaths, I believe, in people who are fully up to date on their vaccines. All of the other deaths are from people who are not up to date. And since about 40% of people in Oregon are up to date on their vaccines, it shows that the vaccines are incredibly effective at preventing serious illness and death. The other news that's come out this week is a new thing about Paxlovid. So Paxlovid is this oral antiviral medication. And what they're seeing in a few percent of the cases, people take Paxlovid, they get better, and then a week or so later, the symptoms of the COVID return. They tend not to be very severe, but they're symptoms of COVID, and you can even test positive again. That, again, is not shocking in medicine. We'll see this not infrequently where somebody has something like a urinary tract infection, and they get prescribed antibiotics for 3 days. They take it for 1 day, feel better, and stop, and then it comes back. Or somebody with a skin infection who has maybe impetigo, we treat them with antibiotics. They get a little bit better. They stop for whatever reasons, and then it comes back. So this is not all that shocking. It's certainly not a reason to use Paxlovid. We have plenty of Paxlovid around, and the goal would be that if you're at moderate or high risk for hospitalizations, that is, you're over 50, you have some underlying condition, you really should talk with your provider about getting an antiviral medicine such as Paxlovid. The other thing I want to point out is that influenza is still around. We're still seeing some cases of influenza, and influenza is nasty too. And so if you are sick, you should get tested for both flu and influenza. And if you're positive, you should talk to your doctor about getting treatment for either flu or COVID or influenza, because there are some good treatments. So that's where we are with COVID. We're expecting still to have a fair number of cases over the next few weeks, but then I would think by the end of June, we should be in another quiet period. Now, all of this is predicated on whether or not there are going to be any new or nasty variants. There's this BA4 and BA5, which is in South Africa. We've had a few cases here in the US, and we're not quite sure if they're going to spread throughout. So that's where we are with COVID. But the new word this week is about avian influenza, so bird flu. And there were some cases, especially centered in Eugene in the goose population, but then there were other animals involved. So the person who's in charge of that for the state is our state veterinarian, Dr. Scholz, who's with us today. Welcome.
Yeah, good afternoon. Thank you.
So tell us what we need to know about avian influenza.
Yeah, so avian influenza is first of all is not just one disease. As with influenza in humans, it's a whole group of influenza viruses. They're all influenza A viruses. By nature, they are zoonotic potentially. However, the strain that we're currently seeing is not known to be significantly zoonotic. CDC does not believe it is a high risk, or has classified it as a low risk to the general public.
You and I know what zoonotic means, but explain to the rest.
Okay, yeah, so that's a good point. So zoonotic diseases are those that can pass between animals and humans. So, a lot of the new diseases we see emerging in humans are zoonotic in nature. They originated in animals, or every so often, occasionally, we'll see the opposite too. That diseases can pass from animals or from humans back to the animals that those humans care for also. So this particular strain, so influenza is actually taking a step back. Avian influenzas circulate in a wildlife reservoir that is the duck. So the ducks, wild ducks, as they're flying overhead, can carry these influenzas. They're really common in wild ducks. And the North American strains we normally see don't really cause very many issues if they get into our domestic birds. They can get into our domestic birds, maybe cause some sniffles, sneezing a little bit. They get over them. We're fine. Every once in a while, there is a possibility that some of those can mutate when they're in the in those domestic birds, and can cause mortalities and can cause deaths in those birds. But even then, that it usually is when you get into a really large flock that you see that. By contrast, there are strains of influenza that circulate in Europe and Asia that are what we call highly pathogenic. So they circulate in the wild. They still don't kill the ducks. They will kill geese oftentimes. But when they cross over into our domestic birds, they kill them very quickly. There isn't that ramp up. There isn't a mutation required. They get in and they kill almost 100% of the flocks that they get introduced into, if not 100%. So they're really serious diseases. We don't tend to see them in the US though, because they're more found in Europe and Asia generally. The last time we saw one of these highly pathogenic Eurasian strains in the US was actually in 2014 and 2015. And your viewers may remember, if they were around Douglas County in December of 2014, that national outbreak actually started in Douglas County. The first case in the nation was actually in a backyard flock in Douglas County. So you guys have a little bit of a claim to fame in the animal disease world there. But so in this case, we started seeing, the USDA started seeing this highly pathogenic strain in wild ducks and wild waterfowl in general on the East Coast back in January. And then we've seen it kind of gradually move northward and westward since that time. And pretty quickly, starting in February, we started seeing cases in domestic birds. Last I saw, I think we have cases now in 35 states across the country. Somewhere around 38 million birds have either died from this virus or been euthanized to control the virus in infected flocks. So that's kind of where we're at on a national picture. And here in Oregon, we started, we've been watching for it. We've been doing a lot of outreach and a lot of surveillance for it. Our sick bird calls that we always do, but about early April, we started doing a lot of outreach. We started taking a lot of those sick bird calls, and we're up about 50-fold over last year in the number of those calls we received and investigated. And then in early May, we had a case in Lynn County, right in the middle of Lynn County, that ended up testing positive for avian influenza. And then about 2 weeks after that, we had our second case there in Lane County, just north of Eugene, that tested positive as well.
Wow. So actually in the outbreak in 2014, I knew that flock.
Mm-hmm.
And so it was a flock of backyard chickens that,
Mm-hmm.
that were infected, and that did not spread very much. There were some cases in Oregon, and it was never exactly clear how that started, whether there was a bird that flew over from Asia, which occasionally happens.
Mm-hmm. Yeah, that one, we still think that one, similar to these cases, were likely, bled over from wild waterfowl. But you're right, and we're in the same boat right now. We don't know how this strain got here. We do know that in the summertime, the waterfowl, the wild ducks and geese that migrate here in the U.S., they tend to migrate up to Alaska and up into Canada. And there's 4 kind of pathways, we call them flyways, within the U.S. that are just kind of general regions where the birds tend to stay within those regions as they fly north to south. And they all mix in the summertime. And so we know that we get intermixing there. And occasionally we will get birds that come over from Europe into the eastern regions of Canada, and we'll get birds from Asia that come over into Alaska. And so that's usually how these viruses get introduced into our flyways. But
so for people who have backyard chickens, and we
Mm-hmm.
have many years have had backyard chickens,
Mm-hmm.
tell us what the risk is for our hens.
Yeah, so the risk really is that exposure to wild waterfowl, whether it's direct exposure. The majority of the cases we see in backyard poultry are cases where someone has a pond on their property. Maybe they have some domestic ducks or domestic geese that swim on that pond, but then they also get wild ducks or geese that come into that pond, and then they also get those domestic ducks and geese swim on the pond, interact with the wild birds, and then come up to the barn to eat with the chickens. Or they get some sort of interaction crossover there. That crossover can also be from us. We've seen cases, not here in Oregon, but in other states where, maybe that pond is a property or 2 away, or you go out duck hunting over the weekend and, you come back and you don't change your boots, or you do something where you've got the feces from those wild birds on your boots, on your shoes still, go back, work with your flock. You can transmit the virus that way as well.
So we have lots of other birds here,
Mm-hmm.
Songbirds and turkeys. Are they much affected by this virus?
Yeah, so wild turkeys are. Domestic and wild turkeys are actually one of the most susceptible species. If they get infected, they tend to die very, very quickly. So they're not really a species we worry too much about spreading it as a reservoir, just because they tend to not get very far if they do get infected. The songbirds and the little backyard birds are generally not known to be very susceptible to avian influenza. So they don't really spread it. They don't really get infected with it. There's some research out that showing maybe there's some strains they can maybe be infected a tiny bit, but they're not really known to be a cause of concern or to really spread the virus.
And our big concern is that the current avian influenza that's out there just typically doesn't go from birds to people. But the
Correct.
concern is that there could be a mutation where it might, and then that could be a danger.
Yeah, and as you, I'm sure, well know, influenza viruses are very good sharers. They like to, if you get two separate strains of an influenza virus in the same person or the same host at all, they like to share genes. They act like I wish my preschoolers would act. They share stuff very well. And so that worst case scenario that everyone's always worried about is you get one of these avian strains that kills its host species really quickly. It kills chickens, it kills turkeys really quickly, but it doesn't really spread in humans. But then you get a person, you get that somehow shares genes with a human strain that moves really well along humans, maybe makes us a little bit sick, but doesn't really cause problems. Well, if you get that perfect worst case scenario where you swap, you combine the genes in the chickens that cause it to kill the chickens, and the genes from the human version that causes it to spread in humans, and you combine those together. And we've already experienced what a new virus like that can do to us, and we don't want that. So we do take a lot of precautions in these cases to make sure that this virus doesn't have a chance for that to happen. And so that's where our control measures really come in. Of when we have a flock that's positive, the chances are they're all going to die from the virus anyways. And so we do humanely euthanize those birds and dispose of them and clean and disinfect. And anyone that's around those birds wears full PPE, wears an N95 mask, wears Tyvek coveralls, wears all those things. We get monitored by the county public health afterwards. So anyone that's been exposed is monitored to make sure they're not showing any symptoms that maybe they did get infected with it. So
there is both human influenza circulating, as we talked about earlier on. Most of it is influenza A, and with the bird flu, I mean, that's our fear, that you'd get that rare recombination event where you'd wind up one that would be both pathogenic and dangerous to humans. And so that's the reason to decrease the amount of human influenza. And we can do that with vaccines. So we're pretty much done with the flu season this year. We are really strongly recommending that come the fall, that people get immunized against influenza, human influenza, so that we don't get one of these recombination events.
Absolutely. And we do the same thing. All of my staff are influenza vaccinated. We encourage that of all poultry owners. That's both of our worst nightmares, right? That we have a disease that crosses over from one of our worlds to the other.
Well, I'm sure we'll have a chance to talk about other things in the past, because when we think about the bad human diseases over the last 20 years, last 40 years, HIV, SARS, COVID, Ebola, they all had animal reservoirs. And we know COVID especially has many animal reservoirs, including deer population, big cats, and others. So I'm sure we'll have many chances to talk again in the future. And thanks so much for joining us. I understand you're at a conference today.
Absolutely. And hopefully those opportunities in the future will be talking about historic things and not new current events.
Sadly, we always have current events. So that's good. Anyway, this is Dr. Bob Dannenhoffer, the public health officer for Douglas County, with our COVID conversations and more. Thanks again. We'll see you again next week. Bye-bye.